earlier, I told you about a report from a group of health experts warning that Brazil now faces an unimaginable loss of lives. Well, Márcia Castro, a global health and population professor at Harvard University, is the lead author of that report, and she joins me now. The report that you contributed to, you could argue, it's sort of... what's going on is already an unimaginable loss of lives. You could argue we are already seeing that. How much worse is it going to get?
So first of all, thanks for having me. And you could barely find the words to ask the question. And I have to tell you, writing this paper was one of the most difficult pieces of science I've ever done. I'm a Brazilian, so it's very hard to do this. Basically, we portrayed the progression of the virus, both cases and deaths, last year, from the beginning until the beginning of October, until a week, epidemiological week 41. And what we're seeing now, it's a much worse version of what we show in this paper, and much more compressed in time. So if before we were having peaks of transmission in states and cities over time, progressing over time, now it's everybody at the same time. So it's completely chaotic. It's really a humanitarian crisis. And we need action now. And as much as the president is against lockdown, when we reach a situation of complete chaos, as we're seeing now, we need the lockdown to stop the transmission of the virus. But what I would say is not only we need the lockdown now, but we need to start planning how we're going to engage what the advantage that Brazil had from the beginning, which is a community-based primary care program. So when cases and deaths come down, we bring a very large number of community health agents that Brazil has. They're ready to take action, and they are not being used since the beginning of the pandemic.
You've been talking about a combination of sort of political chaos and inaction that has catapulted the country into this calamity. I just wonder, therefore, how much, I mean, I've got to ask it again, how much worse is this going to get? And when you start looking forwards, when you start saying, how do we come out of this, where's the political will at this point?
So let's put it this way. The political will at the federal level has not been much. And the wrongdoing that we mentioned in the paper is a leader that disseminates the use of medicines, hydroxychloroquine, that are not effective, does not use mask in public, and clearly was against the vaccine at some point, saying that he would not get vaccinated. So how much worse it can get? Look, if we don't do anything, right, if we just let this thing go, what we're going to have is we can eventually see a decline, but we're going to have another wave. We're going to have new variants emerge. Variants will emerge in places where you have intense transmission. But what's happening now in Brazil is, in the absence of something coming from the federal level, we have groups of governors and mayors getting together, and the response is coming locally. However, Brazil is a very big country. We have 5,570 municipalities. Some of those municipalities cannot take action by themselves. And that's where the lack of a coordinated action becomes a big problem. So I think some cities are going to take action. We're going to start seeing a decline, hopefully, not in April. Not in April. This is going to be the worst month ever. But eventually the decline will happen. But it's not just about making a lockdown and declining at this moment. We have to keep doing something after that. We're not going to increase the vaccination anytime soon. Brazil did not buy the vaccines last year that should have acquired. So our vaccination will continue to roll out in a short pace. So we really need the local action to take place in the absence of the federal one, and start decreasing this huge, huge unbearable burden.
And we've been talking to one of the mayors today, part of a group of mayors who are trying to get some concerted action together locally at their level because they know they're getting no support on a federal basis. You say variants will emerge. And without any action, there are those who say that Brazil will become a security risk to the rest of the world. So in regard to action, not from the local community, but from the international community, what do you think or hope might happen next? I mean, are we facing a situation that could be considered enough of a threat to be, for example, discussed by the UN Security Council at this point? I mean, what is the author of this report would you advise other countries, the international community, to do to help at this point?
So no question that Brazil is a threat to global health security. I think many voices are saying this. We mentioned this in the science paper, and this is obvious. And it's a threat because of the high transmission, and the virus does not respect borders, and it's a threat because of the possibility of new variants emerging. It's not by chance that many countries have closed their borders to Brazil. It's because of recognizing this threat. From an international community perspective, there are many things that could happen. I mean, certainly there are different bodies, international bodies, that could, held accountable the actions that are happening in Brazil. And just this week, we have an investigation that was set up by the Senate in Brazil, and I hope something will come out of this. But there's so much that international organizations can do. The World Health Organization cannot impose some action in any country or other bodies as well. I mean, there is some pressure that can happen from the level of diplomacy, so conversations can start taking place. The other thing that has been mentioned before is maybe the international community could try to send doses of vaccine to Brazil to try to alleviate, to mitigate the problem. On the one hand, that would be great. On the other hand, that's sort of unfair with the rest of the global South that is also lagging behind in vaccination. So it's not an easy decision, but I think that if international organizations, international governments start speaking more about this and really calling the fact that Brazil it's not that it's going to be, is a global health threat, then something might happen from this. And again, we have an investigation from the Senate happening now. So if there is a perfect moment to voice those concerns, both nationally and internationally, with science, with facts, with governance from any point, that is now.
Finally, former President Luiz Lula da Silva said last week that Brazil is facing the biggest genocide in the Latin American country's history. Do you agree?
Brazil certainly is having a much higher mortality than it should. It took about 2 years of life expectancy at birth in Brazil. Brazil is back to mortality levels of 2013. Call it how you want, but yes, we should not have the number of deaths that we are observing now. It's a total unnecessary loss of lives, destruction of families. It's horrible.
With that, we'll leave it there. We thank you very much indeed for taking the time with us today, and I hope that in doing this interview, we get a message out to the international community and indeed to those in Brazil who we support. Thank you.